Shirley's going to do her presentation. It's been an absolute pleasure to work amongst Shirley this year. And I think at the beginning it was very much about we want what is new to become normal. I would hope that actually this becomes normal for people with a respiratory disease.
I think I'm in the death zone. Good afternoon, everyone. My name is Shirley and I'm a community respiratory nurse working in a rural area of Wales called Powys. And I'm going to talk to you about my role in the development of a community intravenous antibiotic service for patients with chronic lung disease. And I wanted to begin by setting the scene. Powys is a beautiful area of Wales, steeped in Celtic history. However, its rurality and access to services poses a real challenge for us. From the most northern village, Llanrhaeadr and Mochnant, to the southern town of Ystrad Gunlais, there is a distance of 112 miles. Powys covers 1/4 of the area of Wales, and with only 26 people per square kilometre, it's the most sparsely populated county in the whole of England and Wales. Powys is unique to Wales as we don't have our own district general hospital, and the area that I serve, which is the northeast of the county, which is a population of around 49,000 patients, my patients travel over the border into Shrewsbury in England for their acute care. Now, rural health deprivation affects our most vulnerable and elderly population. And to illustrate this point, I'd like to introduce you to John and Doreen. John and Doreen are a fiercely independent elderly couple that I've been caring for the past 3 years now. They both have a chronic lung condition. John has memory loss and Doreen is registered blind. This elderly couple who were devoted to one another, and during one of John's frequent admissions to the acute hospital for intravenous antibiotics, Doreen spent £400 on taxi fees to and from the hospital to visit him. Now, John's care could have been provided for him safely at home, reducing the risks to him of hospital-acquired infection, as well as loss of independence that is associated with an admission in our elderly population. When I visited them on discharge from hospital and listened to their patient journey, I felt really strongly that our community services could do better for John and Doreen. And so I was driven to look for a solution to prevent John's unnecessary admissions. So the solution is a pilot project to deliver intravenous antibiotics to patients in their own homes. And I chose one of the 5 practices in my locality to collaborate with, as they have the highest admissions to hospital. To put this into context, the small number of patients involved means that I can deliver this service with a temporary role redesign. The clinical pathway would deliver intravenous antibiotics to patients in their own homes twice daily for a 10-day episode of care. And this service aims to prevent 10 admissions during the pilot period, which would save up to £25,000. The cost associated with the project is £4,858, and this relates to intravenous antibiotics, the cost of consumables, and the cost of mileage payments travelling to and from the patient's home. So in all, this service, over a 6-month period for one practice, aims to deliver savings of £20,000 to the locality. The service would also meet the national strategic drivers and our local drivers of providing care closer to home and enhancing the patient experience. The outcome measures will be the numbers of hospitals admissions, adverse events, patient satisfaction, GP and consultant satisfaction, as well as cost effectiveness. So this project will begin in October this year. This is the optimum time for the pilot due to the winter pressures on beds and the increased prevalence of respiratory illness during the winter period. The evaluation will be available in April 2014. And my vision is that this service will raise the profile of respiratory care on the local strategic agenda, that this will be a successful service and we will be able to scale this out across our locality, and that we can continue to strive to make a real difference to patients like John and Dory with new service innovations, because this really is only the beginning. Thank you.